Friends, welcome back to my channel with a new video. And this time I will be discussing something about mechanical ventilation. And again, I have divided this into two videos. So we'll discuss about understanding and interpreting ventilator graphics, and it is one of the most important kind of uh, subject which we deal as an intensivist day in and out. And of course, for the exam going students appearing for IDCCN or DRNBs or TM, we have a table with the questions on ventilator graphics. So without further ado, let us start. So at the outset, I would like to actually tell why do we need the graphics on ventilator. It will help monitor the respective mechanics on a real-time basis. The real-time graphics can be, it can improve. It can monitor the changes in the patient's respiratory physiology and also allow the closer observation of patient ventilator interactions. So as we know, just pardon me about the next kind of image, but for the simple understanding, why do we need figures? And once we know figures, we would actually form some kind of image in our mind. For an example, if someone talks about 36 24 36, it can be something like this. So this is the classical flow versus time, the first scalar. The second is volume on the x-axis and the time on the y-axis, and this is the pressure and time. So this is how the standard scalars look like. So on x-axis you have the variables in the form of flow, volume and pressure, and on the y-axis you have time, and this is the appearance of the standard scalars. And this is the classical pressure volume loop, and this is the flow volume loop, which looks like this. So the wave which is above, or the positive deflection, is inspiration and negative is expiration. So this is the maximum volume during the inspiration which is achieved is tidal volume, and of course the entire volume will be the functional residual capacity. The the PIFR stands for peak inspiratory flow rate, and PEFR stands for peak expiratory flow rate, and this we will see how clinically it can be of use. So talking about the first, flow versus time, this is how the standard graphic, the inspiratory flow pattern looks like. So this is the beginning of inspiration, and the expiration valve closes. So the positive deflection or the positive box is inspiration, and this particular wave, as we know that expiration is passive, so it will gradually return to the baseline, unlike the box which is preset on the ventilator, and it will looks, the expiration looks something like this. So this is the total cycle time between the two onset of inspiration. This is the peak inspiratory flow rate which we were talking about. This is the total inspiratory time during which the entire inspiration occurs. This is the beginning of the expiration valve getting closed and the starting of expiration. And of course this is the total expiratory time. As you could see that it will gradually touch the baseline. This is the expiratory flow pattern. So as we know that this is positive box is inspiration and this is expiration. So this particular point, the highest negative point on the expiration is peak expiratory flow rate. Similarly, as we know that this point is peak inspiratory flow rate, and this is the duration of expiratory flow. Okay, so this is the total expiratory time, and this is the duration of the expiratory flow. So now in this particular scalar, as you could see that this is the square pattern, and classically this kind of ventilation, if you see a flow versus time, this is the volume control ventilation. Similarly, if you see a decelerating pattern like this, with the flow getting cut, with the 25% of the flow which is remaining, this is the classical pressure support ventilation. At the same time, if you see a decelerating pattern like this, where this particular line touches the baseline without cut off of the flow in between, is a classical pressure control ventilation. And if you see something like a sine wave, as you could see here, it is a spontaneous breathing. So just at the look, if you have a glance on the flow time scalar and you identify any of these patterns, you can know which form of ventilation or which mode of the ventilation the patient is on. So coming to this normal versus abnormal flow pattern, as you could see, the red pattern, there is a sawtooth appearance, and this is clearly an abnormal pattern where it is seen classically when the patient is generating more efforts. So when the patients generate these efforts, the square pattern of the inspiration in the flow time scalar changes to the sawtooth appearance at the in the inspiratory phase, and this is because of the patient's effort. So obviously there would be inadequate inspiratory flow. Similarly, as you could see here, that inspiration is not a problem, but expiration, you could see that the expiration is abnormal since the peak expiratory flow rate is reduced. The highest negative point is come down, and in this particular situation the highest negative point is more than that of normal. So you will be asked in the exam to identify the abnormality. So obviously in the first scenario the PEFR is low, so this is a case of obstructive airway disease, and in the second situation it is a case of active expiration. Now in this particular graph you could see, or a scalar, you could see that the PEFR is reduced and there is a long expiratory time, and there is the thing which is written as before and after. So you need to identify what is the abnormality. So before, you could see that the PEFR is low with a longer expiratory time, and after some intervention the point has gone up and the expiratory loop or the expiratory limb is touching the baseline well in the time, unlike the prolonged expiratory time in this particular scalar. So this is particular case of response to the bronchodilator. So this means that this is before the bronchodilator when the patient has an exacerbation of the obstructive airway disease. This is after the bronchodilator therapy. Now in this particular scalar, as you could see, that this particular patient has the expiratory limb, if you see, is not touching the baseline as it should touch the baseline here. So this particular scalar, if it appears on the screen of a ventilator, this is a case of air trapping or auto peep generation, and this is classically seen in exacerbation of COPD or asthma. So this is a classical air trapping flow time scalar. Now about a pressure time scalar. So as you could remember, this is how the pressure time scalar looks like. And if you have a negative deflection, it only means that the patient is triggering. So this can be a assist control mode, and this particular the starting or the initiation of inspiration above the baseline is probably because of the PEEP. Looking at this, the highest point of the pressure which is generated is peak inspiratory pressure. This is the expiration before the start of the new inspiration, and as I said, this is the PEEP. Now coming to this particular scalar of pressure time scalar, if you see, this point is a peak pressure, whereas this deflection which comes down from the peak pressure, and there is another hump here before it touches the baseline, and this is the plateau pressure. Now in this particular situation, you could see that from the peak pressure, which was somewhere at this point, it has gone up. So the peak pressure is increased, whereas the plateau pressure remains fairly normal or low. This particular condition is classically seen in increased airway resistance condition, like kinking of the tube, bronchospasm, the blocked tube, if the patient is biting the tube. So these are the few classical conditions in our day-to-day practice. Similarly, in this particular scenario, you could see that the plateau pressure has gone up. So peak pressure has also gone up and the plateau pressure is also gone up. So probably there is a problem in the compliance, and this is a classically seen in decreased compliance patients, where you could see that the flow time scalar looks something like this, where if you could see that it will look something like this. Talking about the volume time scalar, so this is how the volume time scalar looks like. This is the inspiration, and this becomes the inspiratory tidal volume. This is the inspiratory time, and of course this is the expiration. So in this particular graph, you could see that the inspiratory limb or the expiratory limb is not touching the baseline. So this could be that this is the volume which is not actually measured, and this is classically seen in the air leak conditions. Similarly, as you could see that this particular volume time scalar, you could see that the expiratory volume, it is going way below the baseline. It is going as a negative deflection below the baseline, and this is again classically seen in active exhalation patients. So this is how the flow volume or the flow time scalar should look like in the volume control, in the pressure control, and in the spontaneous breathing patient. So I think, my friends, today I'll stop here, and we discussed all the three scalars: the flow time, the pressure time, and the volume time. And the further things I think we will discuss in my next video. That's all for now. Bye bye.